Our next presentation comes from Emily Jefferson.
Hello, everyone. Can I just check, is there a rule that generally doesn't let women into this kind of sort of group? We seem to be definitely in the short supply here in terms of walking into the room. So I'll now add to that by saying I generally know very, very little about either HPC or AI. Well, I know a little bit about it, but it's certainly not my area of expertise. So I suppose one of the things I'd really like to talk to you guys about is actually saying, well, how can we bring your expertise into this particular domain, which really, really needs it, basically. So can I just, first of all, before I move on, can I just get a general show of hands? Who knows what a TRE is? Yay! Okay, that's fantastic. So I don't have to go into too much detail then. And I realised when I looked at my slides that actually perhaps just using an acronym wasn't the best idea. But fortunately, obviously, that's not too much of a problem. So I was down on the agenda as coming from the University of Dundee, which I do. However, I'm seconded to Health Data Research UK as their CTO. So I'm not really here in the Dundee mould. I'm here with my HDR hat on. So I'm going to give a really quick whistle-stop tour of HDR UK. Can I have another show of hands? Who knows what yet another acronym is? HDR UK. Okay, fab. So I'll go through that reasonably quickly. So who we are, what's a TRE? Trusted research environment, for those of you who don't know. Why do TREs need to scale, and the challenges that we have there, and then where we really need some innovation in this space. So I think it's absolutely ripe for it. So who are HDR UK? So many of you will have seen this sort of general slide. Our mission is to unite the UK's health data to enable discoveries that improve people's lives. And the vision is for large-scale data and advanced analytics to benefit every patient interaction, clinical trial, biomedical discovery, and to enhance public health. Sounds absolutely brilliant. But what I will say is HDR are kind of a different structure than you might think, or a different type of institute than you might think for general kind of institutes like this. So if you look at, let's say, Dementia's UK, they do dementia research. If you look at Turing, they do AI research. If you look at HDR UK, we do health data research. No, we don't quite. So yes, we do health data research, but actually I think what we're more about really is systematic change across this really complex landscape in order to accelerate and streamline the researcher journey. And so although we do ourselves some health data research, it's usually as an exemplar study to really try and push the boundaries as to what's possible. So if we think about the research journey, there's many different steps. And for those of you who maybe don't work in health data, it might come as a bit of a surprise to you to know that there are a very large number of PhD students out there who have started their PhD, supposed to be working on health data, and by the time their funding finishes, has still yet to get their hands on data, which is madness, particularly when they're safe and secure people and all of these different things. It is an incredibly complex landscape, particularly when we're talking about unconsented large-scale data sets. So there's many different components in this space that really need to be resolved in terms of streamlining data governance, getting different groups working together, etc., etc. But I'm really interested in, well, what can we do in the technology area in order to make a difference in this space? So how can technology help us with these things? So overall in terms of HDR, what we're trying to do is improve health and boost UK science by making it easier for researchers to find, access and use high quality data sets. We're trying to provide leadership to fix difficult technical problems by creating innovative solutions needed for researchers to use large scale data safely and securely. And we're trying to accelerate and streamline the health data science by developing open collaborations that connect people, data and organisations across the UK and data. So what's a TRE? So I'll quickly go through this for those of you who don't know what a trusted research environment is. So another word that's been used for them, by the way, is safe havens, or now with the new NHS England SDE, secure data environments, they're pretty much interchangeable terms. So across the UK, there's many different silos of data out there. Accessing sensitive data, which is highly confidential, is really quite a challenge. There's huge amounts of unconsented data out there, GP data, hospital data, lab data. There's a large range of consented collected research cohorts, which might also want to link their data to unconsented data sets. So there is a real change to say that sensitive confidential data across the UK can no longer be given out on as a data download on a USB stick or however these things are transferred. And there is a move to the idea of basically forcing people who want to get access to data to come and use trusted research environments. So the data stays where it is. People have to come in to perform their analysis or to develop their tools, so the data doesn't leave. If I look at, let's say, HES data, which is a widely used set of data on English hospital episode statistics, there's an interesting paper out there about how they can quite easily find Tony Blair's medical history from being able to do all of these things. So the idea with with the trusted research environment is that we're trying to not have lots and lots of copies of potentially confidential data out there. So a trusted research environment tends to follow this idea of the 5 safes model. So often they have a data repository, or that might be another organisation that sends the data in, and then they have what's called a researcher, or I call an analytical environment, and this is often a virtual machine or a series of virtual machines where people go into that environment and they analyse their data. Key thing is that there is no open connection to the internet.superhighways.com. You can't actually, you've got a highly controlled environment, and this is really interesting in terms of engineering, because if you go and try and use a lot of the off-the-shelf solutions out there in a TRE, they break, because they require being able to have connections to the outside world. And so you need to do a lot of innovative engineering in terms of actually making these things fit for purpose when you control that. So the idea is you can only take out something that has gone through a disclosure control process. And this is quite often at the moment in TREs across, there's many different TREs out there, but generally people do disclosure control by opening up a file, looking at a graph or a trend or a table and saying, does that have potentially disclosive data in there? So you're looking for, in a table there needs to be a cell count which is always above the number of 5 or the number of 10, depending on which different group has set that property, so that you're not got low counts in there, meaning that you can potentially work out who somebody is as an edge case. And there's been a general model around the place of 5 safes. So this means safe people. So basically we need to check that somebody trying to access this data is doing so for a valid reason in the public benefit. We have safe projects, meaning that the data has to be pseudonymized and the minimum amount of data to answer a specific scientific question. Safe setting, you have controls around the around internet, and you can't take all of any data out. There's no data leakage, etc. Accounts are all set up and all of those sorts of things. Safe data, making sure that it isn't potentially disclosive, and this safe outputs, basically automated, manual disclosure control of this information. So why do TREs need to scale? So generally, I would say researchers really struggle to scale their analysis as it is in the UK at the moment. And there's many different reasons for this. So right now there's technical feasibility of being able to actually access these different TREs in a way in which you might want to. The tools and things aren't there. It's not scalable in the way in terms of HPC and GPUs and all of the power that you want in there. But also, if you're looking at federation, often because data sets are in lots of different places, there isn't an easy way in order to query the data in these different places. And if you're wanting to do it, what you either need to do is spend a couple of years sorting out all the data governance to do transfers from one TRE into another to look at it together, or you need to keep the data where it is and you need to do meta-analysis around all of these sorts of things. There are technical solutions out there, but to actually get them being used widely and in an easy, scalable way, it's very challenging. Data governance processes. I did a project during COVID where we were trying to put in a new interesting infrastructure working across lots of different data custodians. This was a rapid call. We were trying to do it in the middle of a pandemic, a lot of pressure, let's do it really quickly. Some of the data custodians, I had to do 4 different documents for different approvals, you know, like a security document, a general governance document, this document, that document, and they were 100 pages long each. And this iterating back and forth, it took a year just to get all of the information down there. It is a real challenge. Each different organisation, each different TRE across the country often has a different form, and so you're writing the same bit of information but in a slightly different way, and it's viewed in a slightly different way, and it's sent off to different people, and so it's really challenging. So this obviously then has impact in terms of time and cost. Then once you actually get into a TRE, they have been set up in a fantastic way, generally for epidemiologists to look at data and do observational studies where they take a CSV file, they put it into a stats package, they run some basic analysis, and then they can get that out. That's great for that use case, but that's not just all of the use cases that you need in this world. You know, so generally they're not set up to say, right, how can we have however many nodes and we parallelize our code and send it to it? They just don't. They're not backed by HPC. They don't have GPUs in order to do imaging analysis. Now, I'm making some broad statements. There are some fantastic TREs out there that do have some of these capabilities, but it's not. It's by far the small number of them that are able to do these sorts of things. And so as the world is changing, with basically saying, well, actually, really, the power is linking this sensitive data to other forms of data, then you need to be able to have those environments being able to support multi-omic analysis, AI training, and all of these other things. So generally, TREs don't have these capabilities. So there's a lack of interoperability across them. There's a lack of reuse of technical solutions across all of these different TREs, which have been developed by different organizations, and there's many different manual processes. So if I look across the technology research journey, you've got data discovery, data access, data environment, and data analysis. So each one of these different things that I don't have time today to talk through each one of them. If you're interested in it, I'm more than happy to chat with you about it. But each one of these different bullet points that I've noted here are technical solutions that a TRE needs in order to do something. Each different TRE has essentially developed bespoke solutions across all of these things, and all of them need to be in place before you can get to the final point of a researcher being able to do data analysis. So this is a real challenge, because if a researcher goes to one TRE and needs one set of data, and then they go to another one, it's a completely different system that they're interacting with, it's a completely different process, but often actually they need to get data from these different solutions. And it isn't just a case where you can say, well, let's just have one master data warehouse to rule them all. This wouldn't work in a space where you've got lots of different government organisations, health data, education data, police data, or whatever, that have a legal and ethical responsibility not to just bring all of this data into one place, because they have to make sure that they're protecting that confidential information. So we have to have interoperability across these things, and we have to move towards a place to do that. So HDR are really, really keen on saying, well, actually, to scale these things, we need to move from this solution where one researcher goes to one data custodian, analyzes one bit of data, gets out their study. We need to have an environment where it's an awful lot easier for one research study to use multiple different TREs. The access is streamlined, and the technical solutions are there in order to analyze this stuff at scale. So we want to get to a position in 20 years from now where it becomes completely routine for people to do studies on 67 million people, the current population of of the UK. And so that's not just around sort of text-based, hospital data. That's across the breadth of data. So, wearables data linked to some of this data, multi-omic data, other administrative data, environmental data, all of these things. It becomes relatively easy if you have a research project that is safe and sound and in the public interest, and there are controls around it to protect patient or the participant data, then we want to be able to do this sort of research at scale. So where are we working in terms of areas of innovation to support this? So HDR are quite a big organisation. We're supposed to be around for the next sort of 20 or so years. We have a 5-year funding cycle, but we are only a small player in the very, very wide ecosystem. So how can we bring people together to really make a difference in this space? So it's not just us sort of trying to do these things. And so for me, what I think we're really trying to do, and this is a new thing that we're doing that's different from the previous 5 years, and that's really trying to go, well, let's build a technology ecosystem. And so I'm delighted to be here today because you're the people that I'm wanting to reach out to. And these are relatively new slides, so please do feed into them. So what we need to do is bring together the community and say, what are you all doing? Can we bring people together? Can we have meetings like this where we actually discuss areas of innovation and how we can make a difference? How can we bring together people? So it's a repeated thing: training, capacity building, etc., real challenges. How can we help people develop in this space, and perhaps maybe bring in a few more women into the field? Also standards for interoperability. So this is going to be absolutely key. So how can we try and help those who run TREs, those who are doing these sorts of things, actually really sort of move forward by working together. So please help us develop these. Then also beyond health, although we're health data research, there's a load of questions that you just can't answer unless you link with other forms of data. But also, a lot of the technical solutions for managing sensitive data sets are applicable not just to health, but are applicable to many other areas. So how can we make sure that we're working across disciplines to build innovative solutions that can be applied generally to sensitive data? So we're doing some work. I don't know if you've heard of of DARE, which should be an acronym that I can just tell you what it is, but I've just realised I can't. So DARE are trying to look at across both health and other disciplines. How can we create infrastructures and standards and move this forward? And HDR UK are hosting DARE. And the other thing that's actually really key for me is valuing the science of the infrastructure. So in my world of coming in from Health Data Research UK, a lot of the conferences and stuff that I would have historically gone to that were HDR conferences, absolutely fantastic. You've got a clinician standing up and talking about the analysis that they've done on data, coming out with a brilliant health outcome. Fantastic, that can now go into policy, it can then make a difference in terms of patient lives, and that's right at that other end. But actually, there's a huge bit of science of the infrastructure where we can bring people as yourselves who research in this area and really recognise that in its own right as well, and actually sort of treat these things as complementary skill sets. So we should be bringing in both the end journey of the clinician providing the answer, but also those who've said, well, actually, we really innovated. We actually brought in this new architecture for doing this, that, and the other, and we had reproducible science. We had a load of geeks, and they did this, that, and the other. And that underpinned the final health-based output, and that made a real difference. So recognising and valuing your outputs. So there's also, if you notice, there's the technology solutions here are the same. I've done in the same colour as the overarching rest of the ring, and that's because there's a huge number of technology solutions out there that are built by the technology community that are not anything to do with HDR, but are absolutely brilliant and should play a part in this ecosystem in terms of how these things work together. However, we are also doing some other technical solutions ourselves. So some of the things that we're developing are there to try and help the ecosystem, so help people find different solutions out there, help people navigate that area, provide some of that interoperability components between different TREs. And then also we're building some technical solutions that we're wanting to co-create with different groups out there, so that we build something once and many people can reuse it, so that we're not just having every single group building their own bespoke solution. So those are our two sort of main areas. And these things we're very much wanting to co-create with the community. So this isn't about HDR just having our own things. This is around developing in an open source, open standards way, different solutions out there. And those things are moving forward. And that's, again, a bit of a change from the first 5 years. This is now a sort of maturing as an organisation and now wanting to do these sorts of things. So I'm waffling a little bit too much. I need to crack on and speed up here. So we very much want this technology ecosystem working together with lots of different things. So how are we doing on this space? So we're wanting to help people to discover data, help people to discover data uses, publications, people and things, software and analysis scripts, so that we can have a solution that really helps people to find and navigate that area. So I would generally say, this is my little pictures of all of those different TREs that have each of their independent bespoke solutions. The little blobs there show that there's some sort of sharing across them, but generally not widely done. And what we're trying to do is we've got our gateway, our HDR gateway, and this we're evolving so that it can actually be a directory to different solutions out there. So to help people find whoever's built something else before that they can maybe reuse and collaborate on. And we're also wanting to provide some capabilities in there that mean that people can reuse those solutions and over time evolve that into being a helpful resource to do. So we have what we're calling our Gateway Mark 1. These are all of the different capabilities that the Gateway currently offers that's up there at the moment. So it helps people find data sets out there, query across lots of different ones. It has a feasibility analysis tool so that you can actually query and say, you know, this particular data set, how many people are there who are female, who have asthma and are under the age of 25, and it can give you a dynamic query and pull that information back. It also has a standardized way of putting in a data access request form, so standard form that can be sent to different data custodians trying to get through that challenge of data governance. And it also helps people to record what different research projects have been run on a particular data set, and provides the transparency to the public in terms of these are the different projects that have been supported with this data, and this is why it was in the public benefit, and basically not just have everything hidden behind the wall, so that people can actually get trust in how their projects are being used. Then there's also the idea of data discovery, so you can find software out there and tools and things. So I'll quickly go through this. This is just me talking about the idea of being able to send a query to multiple different data sets across the country and be able to find out which data set might meet your search criteria, so that you don't have to pick up the phone or send emails to every single one in order to search that space. You know, it can literally take a year for people to find out which groups won't be able to help their research projects. It's a huge amount of effort. So the Gateway, as I would say at the moment, it was written pretty rapidly during a pandemic, lots of different functionality sort of trying to put in there quickly, but I would say it's a stepping stone. So what we're doing is we're now moving to Gateway Mark 2. I'm trying to go with the branding of, I don't know if you guys remember the Gillette razor thing. So we're going with Gateway Mark II, the best the data scientists can get. We're working on that one. I'm still not quite got Andrew Morris to agree that that's appropriate branding, but we'll go with it. So anyway, so we're re-engineering significant components underneath, bringing in an awful lot more sort of data science expertise and really creating this solution in a scalable way. And we do want people to come and work on this. So if, let's say, Gateway doesn't do something that you really think it should do, fantastic. You've got some developers, brilliant. build it, we'll integrate it, and we'll work together on doing that. Let's make this this shouldn't be an HDR solution. This should be a community solution that we can work together. So I think I've gone through most of these. Community developed, don't reinvent the wheel. We're building on lots of existing solutions out there. Exemplar driven. Standards and interoperability are key. Technology should streamline and enhance processes, automation first, and actually listening to people's feedback on things is always good. So I'm delighted to say that the SDE network that has been set up in NHS England, what they've done is they said, we're not going to give out data anymore, we're going to set up both a national and regional SDEs, otherwise known as trusted research environments, for people to come and analyse health data at scale. And they've basically partnered with us, and they say they're wanting to use the gateway as their sort of front door for everybody to use this and have a standard data access process, a standard way of finding data and cohort discovery around those different things. So that's great. Scaling and next generation capabilities, I think there's a huge amount of innovation we can do in this space. So as I was saying, generally TREs, they support epidemiology studies across the piece. We need to really have some innovation in saying how do you enable it so that you can have genomic data in there, imaging data in there, programmatic access, automatic installation of all of these tools. If we're going to force people to come and use TREs, they need to be as good as if you've got that data in your own environment, and we're just not at that point. So we were hearing about the large language models. The data that we've got in terms of NHS data from free text information and other hospital data and GP data would be absolutely and utterly fantastic for training some of these things and make much better detailed, accurate solutions if we were to train on that data. But there's no way that data will be let out in order to train on it. So we're wanting to create environments where you can actually come and do all of these things, but you're not going to be able to create an environment unless you've got all of the GPUs, CPUs, etc. in order to do that training. So we really do need to think about how we can do that. And one of the key challenges here for me, which is an area of kind of my own personal research, is saying, well, if you're wanting to develop AI in these, fantastic. However, you've got a nice trained model. When you then send that trained model out to the person who checks the graph or checks the table to say, is this disclosive anymore? How do they do that? So if you can't check for disclosive information, then there's absolutely no point in putting the data in the TRE anyway, because that takes away the whole purpose of a TRE, which is to make sure that row-level information isn't exported. And you look at a lot of different models. Support vector machine. There's a load of them in there that basically encode all of your training data as row-level information. You export the model. You've exported all the row-level information, which is against the whole idea of a TRE. So how do we innovate in this space? How do we do attack simulations? How do we get people within TRE environments trained up to understand AI to actually mean that we can also make sure that we're not accidentally leaking things, or there isn't a model that comes out that is incredibly easy for a hacker just to query and pull back some of that information. So that's kind of the really interesting areas that I think we need to do. So this is bringing together these two different worlds. DARE is really sort of trying to innovate in this space, and there's a lot of different excitement in there. I have just explained to you about the problem of how you do AI within those environments. And so it's really about this AI coming out. If you're interested in the challenges of that, we've recently produced a paper on the disclosure control and challenges with AI, and also some recommendations for disclosure control from the Grey Matter project, which is saying, well, how can TREs become enhanced in order to check for disclosive information within AI. There's a range of different DARE funded programs really innovating in this space, and I'm really hoping that the next phase of DARE will also do some of these things. I think some of the DARE projects have been the sort of same old people who've been innovating in this space. It would be fantastic if more people could come and try and address some of these real challenges of scaling AI and scaling TREs and innovating in this area. And I will just stop at that point because I am over time.